Hi everyone, Dr. Omi from Pain Free and Fit. Today, for those of you with lower back pain looking to train legs heavy, we're going to be going over the concepts and principles of how to use a hip belt in relation to your spinal stability pattern. We'll also be talking about foot position and anchor points for the resistance that you're working against in your weight training exercises. Hope you enjoy. So using a hip belt for lower back pain prevention and injury-free training with heavy leg training is one of the techniques we use to prevent pain with disc problems, spondylolisthesis, stenosis, degenerative discs, facet problems, sacroiliac problems, because with a hip belt, you're allowed to take the weight that typically compresses vertically the spine, such as with deadlifting and back barbell squats, or even handheld hex bar squats and deadlifts, and takes the force and changes it so that the hip belt creates the force from the hips down, sparing the lower back. If I do a vertical type squat, like the sumo squat I'm about to demonstrate, the weight is pulling on my hips, not my low back. It bypasses the compression on the spine from above. With either a machine that does that with weight on your shoulder, with a barbell squat, even heavy overhead work, this is a way to train the leg muscles, the hip muscles, very effectively, but bypass the compression, which particularly is bad for disc-related injuries. The other thing we can use a hip belt for is a translation, A to P type force. Many lower back pains, even though you bypass the lower back, still there's an extension strain, because if your lower back extensor muscles are weak and you have a problem with extension, many times even this type of exercise where you're bypassing the compression, there's still some extension, meaning a backwards tension or actual motion, depending on how well you hold your neutral spine, that can irritate the back. So here we're going to take the hip belt and we're going to shimmy it down so it's lower around what's called the greater trochanters, the widest part of your hips, and we're going to use either a low cable or a band or any type of lever type apparatus where the force is now in front of us, and because the hip is low, bypassing the back from a long way because we're lower on the pelvis, now the force is coming front to back. So I can do, say, split squats or Bulgarians with my leg up, and now as opposed to the typical pressure of upright, the motion is more front to back. And as I do that, the legs are still getting an awesome workout, particularly the quads. You're going to use more of your quads as you're going that A to P or front to back motion, and less vertical compression. So let's go over these concepts a little bit because it also relates to foot position to protect your lower back. Now, before we begin, make sure you put your body in your unique neutral spine position. That's going to be different for every single person. For me, I need to make sure I keep my left hip down so I don't hip hike, and I engage my left multifidus at L5. For others of you, you may have to relax your internal oblique. You may have to relax a dominant lat muscle. You may have to anterior or posteriorly tilt your pelvis to get the right position. We're all different. If you don't know yet what your neutral spine position is, that's what all of our programs are designed to teach you. We have a beginner's intro to what neutral spine is and how you can build it piece by piece and section by section by identifying your weak core muscles and your typical posture and movement tendencies that are affecting your lower back pain by checking out the free body analysis at painfreeandfit.com. So before you do this or any exercise to protect your back, we always want to make sure we're in our unique neutral spine. We set that position, we set the appropriate core muscles in the right way to reflect our corrections of any dysfunctions we have, any imbalances, and then we get into the exercise. So the first one, let's talk, since I have my belt a little lower right now, let's talk about this A to P movement. So for in this instance, I'm just going to use a power band, but you could use a low cable apparatus, like I said. You could use a lever apparatus, like a lever bench or a T lever row. Whatever works for you. We have resistance in front of you. Many times I also used to use a lever. I have it over there in the gym. We don't have the camera on it now, but a body solid lever bench press machine that comes really low to the floor, and I can attach the bands to it, and as a result I get that A to P or front to back motion, just like you would with a deadlift, but I have the band attached so it turns it into a front to back motion. So I could do a normal split squat in this position, and as you see, as the band stretches, as I come down, my motion is not only down, but it's slightly forward. Now if you notice, my foot position is very important. I'm far away from my anchor point. I'm not near my anchor point because I need that tension and I need that ability to have a range of motion where the anchor point, either the weight doesn't hit the ground or I lose that tension on the band. I have my foot way forward. I have a very liberal split stance because if my feet were too close together, I may get a forward knee over the toe, which could aggravate, let's say, a patella problem I may have. So I have a nice deep stance, and my motion is, besides up and down, you'll notice what the band is doing. It's moving front to back. The Bulgarian version of that with the leg elevated, I can even get a little bit more motion on that. And again, I have these blocks in the way, so my range of motion is a little limited, but you get the idea. The force is front to back. I could also use that in a typical sumo type squat where I back up. Could also use this for heavy walks, resistant band walks, where you're walking forward with the belt facing the other way, or stepping backwards. Great quad and glute and ham workout. But in this case, we'll just do a static sumo squat. Again, if you notice, my back is stable, there's no compression, and there's really not a lot of extension on my back because the hips, the resistance is low enough that my back is just stable there. And for added support on my back and stability, I could put my hands on my hips. And if you'll notice, now I'm getting a great quad workout, and the force is more front to back than it is up and down. And you'll really feel your quads ignite. Yes, you are getting some posterior chain with this version, but you're getting a lot more quad. Whenever you go A to P, you're going to be getting a bit more quad, depending, again, on the anchor point and the resistance and the angle that you have. Let's turn this into a more vertical compression exercise. So for the vertical compression, we're going to position the hip belt higher now so that the hip belt is on the top of your iliac crests. If you go to the side of your rib cage and feel to the bottom where it disappears, there's soft tissue to the side of your lower back, and then you're going to hit a hard bone on both sides. That's your iliac crest. That's the top of the pelvis. That's where you want the band or the belt to be locked on. That's the idea. You want to make sure it's cinched up enough so that it doesn't move past that point and stays locked in that area. You're going to engage your RPI neutral spine before you descend. You're going to pick your appropriate range of motion and anchor point, affix, set your core, and I always like for the first rep putting your hands on your legs. It helps to get the weight up in the position a lot easier without jerking the lower back. Again, I make sure my core is in sync and I begin my squat. Now, I can do this with my hands on my hips, on my upper thighs for added stability to my lower back, letting the arms help with that. Or as I get better and get more posterior strength, I can keep my hands in front of me as I do my repetitions. And again, depending on your block arrangement and your available range of motion that you have in your hip joints, that range of motion may change. But the idea is now your feet are on the sides of your weight, your anchor point, your feet are much closer, which allows you to have more of a vertical stress on your body as opposed to a front to back A to P stress. So plug these into your training, figure out what's more irritating to your lower back. Those of you with spondylolisthesis, retrolisthesis, it may not be compression that's bothering your back, but more of a translation A to P or front to back, because that's going along the sides of the planes of the motion that aggravates your vertebra. The vertebra has slipped forward or backward. So you want to protect against that. So you probably don't want to use an A to P translation like we were doing with the band. You want to use more of a vertical compression where your feet are more centered around the weight, the anchor point, the resistance, and that allows you to prevent that A to P shear, but emphasize the compression part of it. Many spondylolisthesis and retrolisthesis cases have disc involvement, so using a hip belt in this type of a squat off the blocks helps to decompress as well as avoid that A to P translation. If you like this video on resistant points, hip band training, check out our channel, subscribe to it. We've got a lot of great videos out there to help you with fitness, healing exercises, weight training, all preventing pain, not only the lower back, but shoulders, knees, etc. Check it all out. We've got several books for spondylo, degenerative discs, retrolisthesis, even walking exercises, all available at the painfreeandfit.com website. All of our programs have an analysis so you can figure out what your mechanical errors are, what your muscle imbalances in your core are, and how these relate to the repetitive stresses that go on your back and prevent you from working out hard and enjoying fitness because you're aggravated by your back. Once you stop aggravating your back soft tissues, you'll be surprised how well your body can begin its healing process which you've been getting in the way of because you keep aggravating it with repetitive dysfunctional movements, dysfunctional postures, dysfunctional stable patterns in your back. I hope you enjoyed this video on hip belt training and resistance points and helps you prevent lower back pain with your lower leg weight training exercises.